Hello, Ansari sir. Uh, Hello, good evening, everyone, for joining the wonderful webinar on from lab to boardroom, transitioning from pharmacy to business and management. I am Sachin Bhatt. I will be the moderator for this insightful session for the day. And before jumping into the panel discussion or any talks, I would like to set a context for the webinar. The pharmaceutical industry, you know that it's as a traditionally been driven by researcher innovation and scientific expertise. However, the industry evolves with the new technology demand and every trends which is happening in the current scenario. Uh, the basic, the bridge gap between the scientific knowledge and the business management to understand what is the need from the industry with respect to the skills that they are looking out for their business and management, and what is that background they are looking. Uh, with that, with the aim of shedding a light on what industry is looking, what academicians are doing, and what is that gap they are trying to fill, so that all the graduates from different background, like B Farm, Farm D, or any of the background is looking at doing management and business roles. So we'd like to take the insights from the expert who are available. Before I introduce my panel, I would also like to remind my audience that whatever questions or the queries you have, you can put it in the chat box and we'll address at the end of the session. So we'll be able to address as much as possible, or we'll take it on the offline mode by my team, and we'll be able to connect the respective panelists if it is to be addressed by them. So moving further, I would are already there. Ms. Seema Bhandarkar, Regional Country Lead Commercials from Biocon Biologics. Hello, madam. Welcome to the webinar. Who has 20 plus years of experience moving from scientist role to leading of the team who looks at different commercial part and management part. Then we have Miss Alicia Menezes from Zydus Healthcare, who looks after project management and in the back end in aspects of marketing and business development of portfolios and brands. And we have Professor Vikas Pandey sir, who is Professor and Dean of Mangalayatan University. And we have Mr. Ansari sir, who is Associate Professor at IIHMR Bangalore. Because Pandey sir comes with 20 plus years of experience from industry as well as academicians. So he has, we in this panel, we have a lot more insight to be gathered from the panelists. And Ansari sir comes from the marketing and consultant experience from the different industries, basically at the pharma sector. And he is currently with us. Welcome you on board. So all the panelists, welcome again to the wonderful webinar. And thank you for joining us today for all the audience. So before I jump into the specific questions, I would also like to get some insight, give insight why this individual webinar is going on. You know that there are, I already set a context that there is a need, there is a gap, and there is something happening in the industry. And you know that the basic people who are like, even I'm from a pharma background, we had a confusion when we are completing graduation and where to go, what to do. So to know that, initially I would start from the industry insight and transition that is happening and what they are looking at. So the first question I would like to ask Ms. Seema, that with your experience in transitioning from scientific background to the commercial leadership role, what are all the key skill competencies required to succeed in this business side of the pharmaceutical industry, and what is happening currently so that we understand the industry per se of it.
Thank you, Sachin. Thanks for the very good introduction. I hope I'm audible. Am I audible?
Yes, you're audible.
Please confirm. Okay. Thank you.
Yes, you're audible.
Very, very apt question that you have asked for me. I'll definitely give you a context. While spending for about 12 plus years in lab from the scratch, probably being as a technical scientist to a senior scientist role, I have what I realized is over the time, one should have, a lot of agility. You need to have a lot of adaptability in them. So after I have moved into transitioned into a business role, um, if you are looking for certain transition like this, stay updated with everything that's happening in industry, in pharma. Stay yourself updated, upskill yourself, have a good communication. Communication is the key in this role when you come to business or any operations role. And the another major thing that I would like to tell the audience is the pharma industry requires a lot of technical knowledge, technical understanding of the products, especially when you're dealing with the products that you're in the commercial sector. So you're actually selling the product, you're actually doing the business. So you need to have a good knowledge about the product, how the product is moving, how the product is actually performing, dynamic part of the market analysis, also the strong technical knowledge. So if you have transitioned from a technical role to a business role, the advantage what happens over here is you will have a strong technical background which is carried out, that helps you to assess the situation better, also understand what's going on there, and also be good in networking, understand how things are happening, and keep meeting people, keep making that, good connections so that you understand the business well. And the next thing is your analytical skills, of course. Now the trend that's happening, we're all aware about the AI and the analytics. So just keep updated yourself with all analytic skills that's required for the business. So which makes you, more strong to stand out there. That's it.
Yeah, thank you, madam. Uh, I understood that. Okay, this is what the industry needs: the communication, understanding of the technical knowledge, what is happening in the lab, and what can be put out in the market with a technical background so that it can be sold and made it as a commercial entity or any commercial portfolio or brand. So moving forward with that background, I would like to ask Miss Alicia on what are all the unique aspects differentiate pharmaceutical marketing from other industries. How does the pharmacy background add value to the marketing and business development roles?
That's an interesting question. Um, First of all, I would like to confirm, am I audible?
Yes, you're audible.
Okay. So according to me, I feel the pharma industry is slightly different from the other industries in the aspect that it is deeply rooted in science. There's a lot of regulation, a lot of ethics, and even the most important is the patient is the core center. If you go to see FMCG and technology industries, they work on what is the trending in the market and what does the consumer prefer. Whereas in the pharma industry, the product which are launched have to be backed by strong clinical evidences. There should be a lot of data to support it. And that is why, because our stakeholders, be it the doctors or the regulatory authorities and the patient, require transparency and accuracy from us. Coming to the marketing side of the industry, marketing in pharma is not just about sales. It requires a strategic partnership, licensing, all of which requires a detailed understanding of how the molecule works, how the drug development works, and even the regulatory pathway for each region, each country. So I think having a pharma degree over here would be actually a distinct advantage for people who have done pharmacy. Why? Because you would be able to talk the language of a researcher, and even you will be able to connect with the business leaders. And you would be the bridge between innovation and commercialization. Giving you an example, if you have a degree in pharmacy, you will be able to understand the technical terms, and you will be able to concise huge clinical data or even scientific data into meaningful small messages, which would align with what the business really wants. Um, to tell you about me, when I transitioned from R&D to the product development or project management, I realized how really innovation meets real life impact. So from this, I come to know that the pharmacy degree really adds a value here.
Yeah, it was a great insight. So basically, you're telling that a pharma background or a graduate would understand better terminologies and technology of the pharma industry, as well as what is requirement by the end user. So basically,
Correct.
where Seema madam mentioned on, these are the things, the skills a commercial leader should have. And if you are from pharma background, this will help you in getting the knowledge of what the demand is and what is the supply is. So you have to, satisfy industry, as well as look out how the user is accepting your things.
Absolutely.
That was great insight. Moving forward with this aspects from Seema and Alicia, I would now approach Professor Vikas sir on understanding. Sir comes from even the industry as well as the academic background. How is academia evolving to prepare students for managerial roles in the pharmaceutical industry? And what initiatives are being taken by the academic institutions in the aspects of this uh, contrary which is happening now and the need in the industry?
Yeah, sure. Just would like to reconfirm that I'm audible.
Yes, sir, you're audible.
Okay, okay. Sorry, very good evening and namaste to everyone, whatever present here. Firstly, just would like to congratulate the IIHMR for conducting such a fruitful webinar. And coming to before answering question, I got your question, and state that the company produces the products so they go into the market. And academia basically also produces the product, which become the potential persons in the industry. Means we transforms our products are actually basically the students. So coming to your question, that it's a very good question, because academia has a very important role in developing the students in the form of their aspirations, their whatever they are thinking about. And since it's also important because this webinar definitely majority of the people will be the students also who are aspiring for the exploring the career options in pharmaceutical market. So I would like to start with the thing that basically academy is no longer just about textbooks and exams. It's about basically transformation right now. That is, the pharmaceutical industry today demands leaders who understand both, that is, molecule and markets. So the academia currently is integrating the real world business scenarios into the curriculums actually. How? Via the case studies, live projects, and industry-driven problem-solving sessions. Secondly, the academia right now is also fostering leadership skills through experimental learning. That is, thinking about the simulations, industry mentorship, entrepreneurship. Like, for example, in where I'm working, we have a very good incubation center where we used to train and guide the students to just how to be a startup and entrepreneurship. Third, the academia is also bridging filling the life like this mission and the formal language is also that Sima Madam also said that we have to be stated and communicated. So we are also bridging the gap between industry and via the various exercises like corporate tie-ups, internships, and guest lectures from the industry stalwarts. So ultimate goal is to turn pharmacy graduates or whatever the graduates after we have seen that there is a amazing expansion in the healthcare sector after COVID-19, and there is a very huge even for the education from healthcare sector. So now academia is trying pharmacy graduates to turn into agile business leaders who don't understand medicine but also market strategy, regulations, global trends. The boardrooms of the pharma need visionaries, and this is how the academia is shaping right now. That's from my side.
Thank you, sir. It was understandable that, okay, Mark, the academics is reaching out to industry to give more insights on what currently the industries are following and expert talks maybe, and many regulatory aspect which is changing can be known to the industry people, and students also can get to know about what regulatory requirements are with the industry needs. Going forward, I would ask our Ansari sir on different aspects that in our program. So, in your experience, how can management programs be further refined to align with industry needs in the pharmaceutical business and management, and how you look forward for it?
Yeah, thank you, Sachin sir. First, can you confirm if I'm audible? Sir, am I audible?
Yes, you're audible.
Yeah, thank you so much for this
Yeah,
question.
you're
Right?
audible, sir.
Yeah. So as Dr. Vikas Pandey sir has already highlighted, there are some initiatives which are being taken up by institutes to prepare the students for industry, right? My point here would be that all those institutions who have pharma management program, they should adopt a very comprehensive approach. And when I say comprehensive approach, with that I mean all relevant stakeholders, industry experts, that includes industry experts, alumni, and academicians from other institutions who have the similar kind of program. They should be the part of curriculum design and periodic updates. That is very important. The reason behind that is pharma sector is very broad and it's very dynamic, right? So you know that in pharma sector there are many departments, there are many functional areas like sales and marketing, supply chain and distribution, pharma consulting, right? So just inviting one or two industry experts will not help. My suggestion would be that if we have 10-15 modules in pharma management curriculum, for each module we need to invite an industry expert in line with that module, and only then it will help. For example, if we invite an expert who has an expertise in sales and marketing, so he can add value to that module. But if he'll give feedback about regulatory affairs module, it will not add much value, and vice versa. So just inviting one or two industry experts will not help. We need to invite, many industry experts, considering that how many modules we have. Second, we should also invite our alumni. All institutes, they should invite the alumni, because alumni are those people who have gone through the curriculum. So they understand what they were taught in that institute. And now they are the part of industry. So they will play a very important role in identifying the gap between industry and academia. And third, I would say there are many institutions, which offer the similar kind of programs. So even they have their own insights. So inviting them and seeking their insights will also help. And in this way, we can ensure that our curriculum are in line with the industry needs, and it is very robust. So that is how I would like to answer.
Yeah, thank you, sir. Understanding the different departments or different roles and the different managerial task that is happening at the industry. As you mentioned, it may be product management, maybe portfolio, marketing, sales, business development. It may be with the R&D, or there are different roles. So basically, if you say I'm a leader in the pharma industry and I'm a management guy, so somewhere or the other way, he should have complete knowledge from the scratch until he end up in doing the decision making and selling the product out or building something where the product is out for the market and the right people uses the right medications and all those strategies can be made. Thank you for that insight. So moving forward, with respect to, we understood now the industry is looking for so many things, and these are the areas that we can, build upon or skill upon. Further to that, what are all the career pathways and evolving market trends are there in the industry? Uh, to that, that as you all mentioned already, there is a landscape and there is a need of professional aligning with the industry needs and they get the respective knowledge. I would ask Seema madam on how can pharma graduates prepare for the transition from technical to business roles in the pharma, and you can throw on what all the needs are there.
Thank you, Sachin. In this, uh, as a graduate, if you're a pharma, you're coming with a pharma graduation and joining, I would suggest you upgrade your skills as and when required. So what I have learned through is I have upgraded my skills over the time with MBA, and I don't say that MBA is a necessary thing for you to, to get into this role, but it becomes an additional skill for you to understand the business perspective. Also, some program management skills, if you could add, it will help you to, understand how a stakeholder's perspective is. We are absolutely dealing with the products that is reaching to the patients from pharma. And as my fellow colleagues already explained it, how the how it's important in pharma. But I would also suggest that when you are transitioning from we are trying to transition from a scientific role to business role, it's always an additional good skill for you to have something of the business knowledge, a minimum business knowledge, how this business world works, how the communication actually happens, how do you actually the market works, the regulatory terminologies that is used, the business terminologies that has been used for us to to deal with the commercial and marketing strategies. So that actually helps somebody. And also, additionally, keep yourself updated. I would say always that be ready to learn, unlearn, and relearn whenever you want. That's the very good skill that one can have in business. So you can all the time be set to learn, unlearn, and relearn, because that's the only way you can deal with business. You cannot sit with a certain perspective in your mind that I come from a scientific background, I deal with the process this way, and I don't want to change. So there should be kind of adaptability. So I would say acquire those skills. That would help a lot.
Thank you, madam. Upon your listening to you long back when I was the medical representative, so there was a perspective when we are doing, okay, I can sell. So I can only sell it to one or two doctors because I was in line with them, or I would have understand two doctors in my area or my locality. But when we, learn from my other partners who are there in the same field and doing something, same thing. So I get to know that, okay, if I'm in a 10 doctors, I'm only able to approach two. There are 8 more left. and I could understand, okay, my approach to all 8 are to be different, or it can be same, or it can be, in the cluster wise. So I cannot approach any doctors in one single perspective or one single understanding. It's basically I get to know every day when we evening we have a meetup. Okay, how was the sales and what is going on? Then we get to know, okay, that doctor is not understanding what I'm saying, or whatever he's saying I may not be understanding. So finally I should align, so that the end of the day is that, okay, he writes my prescription, or because he understand my product well, my quality of my product or the outcome of product. So it's basically learning from everybody on every day. So it's a learning process, or relearning whatever I have learned already.
You have to face multiple challenges every day. It's not a straight line, and then you have to create a demand, you have to sell your product. There is a lot of gap between supply and demand, and then you need to also balance that. So that's why I always emphasize that's very important skill one should have to transition there.
Yes, man. And with understanding, it was way long back. It was all traditional way of selling it. We used to carry a catalog to explain my portfolio and brands. Now it's already moved up. There is no catalog or physical paper or whatever collateral which I used to take as a printing material, which was coming from the C&Fs and as well as the plants. Now, with that, I would like to approach Alicia, how the pharmaceutical business adapting to digital marketing and data-driven decision making. Can you give your experience in marketing and business, where you basically understand the target audience, get the data, pull up what exactly you have to do? How do you balance the scientific accuracy with commercial objectives when positioning your pharmaceutical brands or products?
That's a big question. Let's breathe now. Okay. Now I think everyone is going digital, but this is my personal belief that, the pharma industry is transitioning gradually towards the digital world. As you mentioned that earlier, the sales rep used to go to the doctor's clinic, and there were seminars and even the pamphlets which used to be printed. But now you see a gradual change that people are going towards iPad, and that is how they're showing the information. So there's a gradual change that is to be agreed on. Not completely, we're not completely gone off that track. There are few reps who need, doctors who need rep visits and everything. But we see a transition, a good one. To give an example of how the pharma world is transitioning from digital to even data-driven decision making, we see that real-world data and real-world evidences have helped a lot the pharma industry. How is because in the clinical trials to understand how a molecule would work outside the clinical trial. How do you take a huge data and how do you comply that and then even come to a conclusion? So real world data and evidence have really helped in that case, where the pharma industries are able to jot down marketing strategies and even target patients accordingly based on the data. So this is a good way that I've seen that digital transformation is happening in the pharma world. That being said, regulatory agencies are there in different domains, and one must adhere to that. While putting across a message, one must be careful of not giving wrong information, be it to our stakeholders, be it the doctors or the patient. Now, that being careful on about how you leverage your scientific and commercial need. I think every product or every molecule has a story to tell. So according to me, I would go on evidence-based storytelling. Like if there's a molecule, I would bring the journey of how it came and what are the challenges and how it could cater to the patient. So that is how I would leverage, putting the molecule across and bringing the leverage between the scientific and the business world.
Thank you. So understanding the industry people, so I could say that there are so many opportunities, career pathways, where understanding the management principles as well as technology aspects, understanding your target users. I know there are many things to decide upon for any commercials or business or any management per se, if you consider. So it's not
Absolutely.
only one thing that, okay, I learned and I would be able to succeed. So there are many aspects. And with regard moving to understanding of academics, on this pursuit of how we are emphasizing on different aspects, I would ask uh, Vikas sir on how the what are all the skills that academic institutions emphasize on preparing better students where industry is looking at and align with the careers in the pharma business sector, and what collaboration efforts can academic institution make to achieve this?
Yeah, okay, Sachin, thank you. Just let me do some key skills, institutions, and collaborative efforts, right?
Yes.
Firstly, just you shared your voyage during the sales and marketing when you used to visit Dr. Sanabha, because I can really feel that, because I also have done the marketing and sales in around 1.5 years, and that is healthcare only in the cardiac division.
Great.
So really, I can understand. And before just answering your question, I also Seema Madam said a very good, very important thing, that you have to upgrade yourself, learn, unlearn, relearn. That's very important. Me myself, I can give the example that I've done my diploma, then my bachelor, then my master, then PhD, then postdoctoral fellowship, and right now doing also one MBA. And as far as the healthcare is concerned, definitely I would wish to be the student of IIHMR.
Please.
Yeah. So let's say, actually, this is a very important question from the audience point of view, because as Alicia Madam also said, very important thing, that pharmaceutical business is actually evolving very rapidly, and success nowadays demands more than just a technical knowledge. It means it requires strategic thinking, leadership, and agility. And as far as the point of key skills is concerned, means from academia point of view, there are three actually, basically. The first is that if someone wants to explore the career in industry in the form of anything, like many of my colleagues are working in the product management department of the various industries. So that plays actually a very, I think, a very important role. We just give you an example that once upon a time it was a case study that the FDCs was going very down, but it's one product actually, that is electron, as gives a rocket speed to the company, and now currently even as far as my knowledge is concerned, the FDC is having 3 to 4 plants in India who's just producing electron only. Still, they cannot be able to satisfy the demand of the country. So definitely, marketing strategy is very important, and key skills, as we have discussed so far. But the first one is that business acumen, that is to understand marketing dynamics, pricing strategies, and global regulations. I'm just telling on the basis of what I've experienced during my session, and also while I'm pursuing some courses. The second one is the leadership and decision making. You have to navigate high stakes environment. Then third one is digital and analytical skills, because data driven strategies are the future of the pharma. It is definitely going to be there. So how can academia and industry collaborate? That's a very important question. For this live projects, case-based learnings, corporate mentorship, industry-led workshops, these initiatives has to be taken to ensure to students to make sure that don't just learn business concepts, but actually apply them in real world scenarios. Imagine working on a real product, your strategy while still getting knowledge. I think on this point, Mr. Shamsuddin can better support it. So this seamless academia industry partnership ensures that when students step into the boardrooms, They are not just qualified, they are ready to lead. But that's the transformation the academia is aiming for. And for this, all this capabilities, all this potential should be encompassed by an institute, so that that particular institute can be able to foster, nurture, and train that particular student. I believe.
Thank you, sir. As you mentioned, there are many areas and skills that they have to occupy or acquire to, it's not only entering the boardroom, if to lead anything in the pharma industry. And the relevance that you mentioned, how do we collaborate? As you, as we know that it's completely different when we are studying in the a room of institution and we go out in or step into the field. So there are major gaps that would align. The models in the books is different and the models that works in the field is different. So it's basically do the live projects, understand the field, understand the needs of both demand and supply, so that you get, okay, what works and what doesn't works, and what skills can be implemented to lead anything. And thank you. With this, I would ask or Ansari sir, how does IHMR ensures its curriculum is optimized and aligned with the industry requirements? Could you provide an example how it is integrated IHMR feedbacks and insights from industry expert to refine curriculum or ensure that students are better equipped with the industry relevant skills?
Yeah, Sachin sir. At IIHMR Bangalore, we follow a very comprehensive approach. Every year before the commencement of a new academic calendar, we conduct a curriculum review meeting. And in that meeting, we invite industry experts, alumni, academicians from other institutions who have the similar kind of programs, and our internal faculties. We all sit together and we go through each topic that we have in our curriculum, and we discuss that which topics to remove, which topic to modify, and which new topics can be added based on the feedback. All these suggestions from this meeting are sent to the academic council that we have at IIHMR Bangalore. And then finally, the academic council takes a decision on the implementation part. For example, this year, if you remember that we introduced a new module that is Pharma Consulting Practicum, and that is based on the feedback from the industry that there are many students who want to do pharma management. They want to work with consulting firms like ZS Associates, IQVIA. So what we did, in that module, we are giving hands-on to our students on projects related to market research, related to pharma, KOL management in pharma, company profiling, product profiling, how to assess a market for a therapy area, right? So that kind of exposure we are giving. Also, in pharmacoeconomics module, I can recall that we added a new topic that is health technology assessment. Although it is very new to India, but there are many countries, they have started implementing HTA. So that we have added. We are having topics related to market access, and we also providing exposure to US FDA, EMA, because all those who want to work with any consulting firm, that we know that in consulting firms mainly people work on projects from the US and European countries, so they should have that exposure about regulatory bodies of those countries. And along with that, we also invite industry experts for each and every module that we have, right? Because we want, along with the theory that we teach and whatever knowledge we give as a teachers, we also want our students to interact with the industry, people, right? So that they should get the insights and that help them, to become industry ready. So, and because we do all these things, and so we get positive feedback from the industry as well. Many of our students, when they were interviewed by any pharma company, they have got very good feedback that you people are being taught these topics.
Yeah, thank you, sir. As per my understanding, I would also add two more into it. So we were when we talked about all data-driven analysis, all those things, I think we have also added the data analysis part as a module in the pharma so that they understand from the SCM part of it or any decision making. So we get hands-on, they can do the analysis and get into the respective decision. So that is one analytic part we have added to managerial skills so that they can play with the data and do something. So multiple tools with respect to data. It may be Power BI, it may be Collab, so that we have training so that they can, as a manager, can access the data and get the decision at their end, not depending on much on the analytics or data scientist part of it. So when we are mentioning of calling the industry experts to review my curriculum or our curriculum at the IIHMR Bangalore, I think we have one panel member who has already come and reviewed our.
Yeah, Seema
Uh,
Bhandakar.
yes,
Seema Bhandakar, yeah.
yeah, she has been reviewing our panel. I mean, as a panel member, she reviews our curriculum with her expertise. So that's it. So we are aligning. So you mean to say HMR is aligning with what industry is looking at, and we are trying to skill up the student with the industry needs. Thank you, sir. Thank you, panelists, for this. And moving forward, I would ask each of you to provide different aspects and advice for aspiring professionals and students with your own experience with rapidly advancing technology, innovation, product portfolio, given n number of department is opening, where when we were there, it was like 5 or 6 numbers of headers or headings or departments in the pharma industry. Now we don't know, so many are there. If you just go in, I just said, like you can see, like Alicia working as a project management, looking at marketing and business development aspects of portfolio, where if you go back 10 years, it was only PMT guys having multiple people under them to do this job. uh, am I right? If you can correct me if I'm wrong. So that was the
Absolutely.
scenario. Yes. So a project management has become a main role where it supports all the independent body which is acting. So and I know that Seema madam is also PMI certified. So you, and it's, its role of being put in every single aspects of developing any aspects or decision making or any running any projects would also emphasize on this. So I just want to give background what industry is doing. Now I would ask, how do pharma companies view candidates with pharmacy background transitioning into business management roles, and what additional qualifications or skills make them stand out? Madam, Seema madam, you can answer this with your expertise and experience. And as an industry fellow, you would also be hiring few of them, and what exactly you look at as a candidate would be like this, so that yes, come and join my team.
Yeah, sure, Sachin. I will definitely share that. Um, back in industry when I started my journey 2004, I would say we hardly had a couple of roles available, as you said. We didn't had probably much clarity that as people have right now, the access to tools, access to all sort of technology, networking. It's humor. I mean, it's huge, the data or the courses that is available online free. One can go there and get their self read, and knowledge wise, we used to look for some good mentor to show the path from where to where, how to transition. We used to carve our path our own way. Having said that, what I mean is the rationale behind this thing is like, right now for a Gen Z, as we call as Gen Z, has a wonderful opportunity, to go and explore, talk to industry experts. You keep yourself updated and understand what's going on in the industry. As my fellow colleagues said already, that there is analytical skills that is available. One can Power BI, you are already adapting, which is very good. I would say I would see somebody coming up with Power BI or some good knowledge who can actually prepare a very good visual representations, which we can present to the management, and quick data generation, where we can connect the data. Data presentation is very, very important. Somebody should come up with that knowledge, and also uh, someone having a good little bit understanding of what's going on in the industry, how to deal with the people, process, and business, how to deal with these three and connect, especially when you are in industry, how know the people around you and deal with them the way it is required. It's a very, very minimum skill that I would look for. You don't have to come with a fancy knowledge and background, and then they do nothing there, because absolutely you have to deal with people around. So you have to have that very a skill that can connect people to people and get the work done. You have to be a go-to person, have that knowledge, and be good in whatever you do. Be very good, understand the depth of that particular work, be good in whatever you do. I would say if you have such critical thinking skills, you're there in industry.
Thank you, madam, for that wonderful insight. Maybe I'll identify and send my kids to you. Okay, when you are mentioning about Gen Z, there are so many opportunities which is identified already. Okay, it's there, so I know that what is there and what skills I can get, and how I can be in that roles. If you consider the coming up generation as calling as Gen Alpha, so even they don't know what type of roles will be there in the industry, because by that time there would have been much more advancement in all the aspects of technology requirement needs from the demand as well as from the supply side. So it is better we go in line with what is the process, people, and the demand is asking for, and get the knowledge and the skills acquired time to time. Thank
I
you.
deal with my Gen Z and Alpha at home. Is 15 and 12, and these boys also keep asking me that how do I actually do? But it's very difficult. The confused generation, how to make them understand when you
Yes.
have so many things around, how to go and get it done. But I wouldn't say that in very loud way. But it's an opportunity for you,
Yes.
you know, make.
So, Alicia, what advice would you give to the pharmacy graduates looking to enter portfolio and brand management in pharmaceutical industry, and what skills should aspiring graduates should develop to excel in this space? Given your expertise in project management, technical knowledge, and as well as looking at data-driven target audience, digital marketing, all aspects of it, what do you prefer?
I believe that pharma is always evolving. There's something new happening every now and then. So four qualities that I strongly believe in and which have been told by my fellow panelists. First thing is understand science, but think strategically. Develop a project, you may develop a product, you may bring it to the market. But finally, the right person getting it at the right time is strategy. And that is an important factor that everyone who is coming into the field should understand. Uh, a combination of scientific and strategic mindset. Second one is you need to have good communication and cross-functional skills. Why? Because you will be interacting with a lot of stakeholders, and it is very important that you have a nature where you can put across your message clearly and there's no ambiguity. That being said, another thing which Professor Vikas said is you need to have a business acumen. That is, if you're entering into any field, you should know how the markets work, particularly in pharma, understand how the regulatory market works, and understanding how do you compare and how do you understand who are the competitors, can you be better than your competitor, understanding pricing strategy. All this is important if you're entering into the business development domain of the industry. And last is stay curious and be adaptable, because from the earlier 10 years back, things were different. But right now, people are going into the digital transformation. People are looking at someone who's tech savvy or understand different concept quickly, is able to represent data visually, which was not there 10 years back. So I feel stay curious and be adaptable to the change. I think it's an interesting field. Um, so these qualities will take you far.
Yeah, thank you, Alicia. I recall when I was looking at different regulatory aspects in the clinical trial of quality, we had standard guidelines. So we understand, okay, US FDA says this. So I have to store my data physically for 15 years, and I can throw it out and put it in a soft copy and make it, store it. It may be pharma document or, pharmacy document or anything. So it was, structured. And if you look at different drug controlling acts, if you say it was standard, now with the evolving technology and transition to all now, it says like AI, ML, algorithms, platforms coming in. You have different regulations that changing every day, policy changing every day. You don't know who is saying what. So if I capture his name, will I be behind bars, or is it okay to capture his name? So it's basically understanding. And recently we have also come up with different medical device regulations. What previously we had class ABC. Okay, fine, I know that which is non-invasive can taken up very easily. If it is invasive, then I have different class B and class C. Now if you see the same regulation, I think I have to again go back and read for one more year to understand what regulatory is doing. So that is what the trend is happening with respect to even regulatory and policy changes. So when you say about brand or portfolio management or looking at the business, so you should ensure that from when the lab to the market, whatever is coming, it's aligning with the when you start. I understand it may take 5 years to 6 years from lab to market. So when you start, the regulatory would say something, but when you're coming to market, the regulatory would have been updated or amended. So you need to align. So understanding the portfolio and brand marketing and management is one of the task, and I understand it should be updated every day. uh, Stay tuned with all the tech savvy things. It's very easy to use and wonderful to act with it, but behind, when you start managing it, so it becomes the problem or understanding with the regulations. So moving forward to Vikas sir, how do you see the role of management education in pharma evolving in the next 5-10 years, and what is the different trend should education institute to be prepared for?
Yes, that's a really important question. Actually, over past 3 to 4 years, and currently what I've witnessed, what I've experienced, the next 5 to 10 years will definitely redefine the role of management and education in pharma. It will going to make more dynamic, tech-driven, as uh, fellow colleague said, and globally relevant. Here also, I think what will come first, that is, first will be the digital complete transformation. AI, big data, and blockchain, it will revolutionize the pharma operations and future managers. And they must be fluent in these technologies, and that will be very important. Secondly, the regulatory agility, it will be quite play a very crucial role, because with evolving global compliance norms, educations must equip students to navigate complex international markets. It is a very important for an institution to equip itself with such kind of things. Third one, I believe, is strategic innovation. The industry needs actually leaders who can drive, not only drive the sales but also sustainable business models in biotech, personalized medicines, and digital healthcare. So, how can institutions improve is that industry-led curriculum updates, as Mr. Shubhi has just updated that Madam is reviewing the curriculum. So that's very good actually. And also one thing Mr. Shubhi stated that health tech assessment type of things IIHMR is doing. So that's really very good. Secondly, AI integrated learnings and immersive corporate collaborations will be a key and a game changer. The future belongs to basically pharma leaders who can think beyond the pill, blending science and strategy. And academia must lead this transformation. That's very important. So,
Thank you, sir. So understanding there might be vast change in the industry needs in 5 years. So looking as academicians, we have to think more than what pharma industry would do with our background of research and data and technology, what is coming up. So we are, I think, ready to take the challenges, understanding the Gen Z and Gen Alpha kids coming up studying the different aspects or technology related courses or professional courses. I think we'd be able to adapt to the industry needs. Going forward, what advice would you give to students and young professionals looking to build a successful career in pharmaceutical industry as a business and management roles? Ansari sir, over to you. You can answer and also give us the background how IHMR is, packed up with multiple, understanding with the industry for next 5 years, and how are we ready to, accept this challenge that industry may ask for us.
Right. First, what suggestions I would like to give. See, pharma, I already have highlighted, Sachin sir, that pharma sector is very broad. Although it's very specialized, sector, but it's very broad. And there are different departments, functional areas, like I said, sales and marketing, regulatory affairs, international business, right? So all those who want to make a career in pharma sector, that too in the managerial role, in the management position, right? They should do a very comprehensive research, just to understand what are the different job roles which are available in the market. And once they have get an idea about different job roles, they do further research to understand that what is the growth trajectory for each job role. For example, if they join a consulting firm as an analyst or associate, at what package they are going to join, and where their package will reach after 5 years, 10 years, and also what is going to change in their job profile in the analyst role, what they were doing, and once and after 5 years, 10 years, what will be their job profile. That analysis they should do. Along with that, they should also list down the skills, because every job role requires a unique set of skills, and they should match with their skills where they lack, and they should understand in the next 1.5 year what skill they can acquire in line with that job role. And so that is my suggestion for them. And I think whoever will be in a position to do all this due diligence, they'll have an edge over others, and they will be in a better position to present themselves in the market, and it will be easy for them to make a right decision, because making decision the right time is very important. I have seen many people, they are very talented, but since they were not able to make a right decision at the right time, they are not doing so well. And there are people, they were not so good initially, but they were able to make a right decision at the right time, and today they are doing so well. And about IIHMR, I already have said, we have a very robust curriculum, and we keep inviting industry experts, we keep conducting workshop, and we make sure that our students, they get exposure to industry insights, they get a chance to get networked with industry people, and so that they could easily get a job and they could get a proper guidance.
Yes, thank you, sir. So understanding the participant would be curious. Industry is talking, and academicians are speaking and telling, "Yeah, we are doing it. Yes, we are doing it." So they would be in the confused state unless and you show them what we are exactly doing. Before I conclude, I would request you to show them what we are doing, what is our curriculum, and how IHMR is doing with the managerial skills of healthcare industry. So if you can take them and give them an insight of our program, PGDM Hospital and Healthcare Management. So that would help them in deciding right time, right career path, right course, right program. So as you mentioned rightly, so if you can give overview of our program, that would give them the clear picture. Yes, we are doing, and there is a program like this. So over to you, Ansari sir. If you can show them the few insights of us and
Yeah,
our
sure.
team.
Sure, yeah. So is my skin visible to you?
Yes, sir.
So yeah. So as you said, I'm going to give a brief overview about uh, just a second. Yeah, I'm going
Yes.
to give a brief overview about IIHMR Bangalore and the program that we offer, right? Which
Yes.
has a specialization in pharmaceutical management. So see, IIHMR Bangalore, it was established in 2004, right? And IIHMR Bangalore is the part of IIHMR Society Jaipur, which was founded back in 1994. So IIHMR as a group has 4 decades of legacy in healthcare management, education, and training. And Bangalore campus has 20 years legacy, 2 decades legacy. And since 20 years, we are into healthcare management, education, research, and consultancy, training programs in health and related areas. And our aim is to provide leadership and competency building among health and hospital managers, planners, decision makers, trainers, and research scientists at the national and international levels. In the next slide, I'll give an insight about what have been the major milestones for IIHMR Bangalore in the last 20 years. So as I said, IIHMR Bangalore was established in 2004. In 2010, we got AICTE approval to run a program called Postgraduate Diploma in Health and Hospital Management. And the intake was just 60 students per year. In 2015, we got NABET accreditation. And with this accreditation, IIHMR Bangalore became the first academic institution in South India for NABH consultancy to provide consulting services to hospitals and healthcare providers. In 2017, we added a new specialization, that is health information technology. And then in 2018, we got MBA equivalency by the AIU, Association of Indian Universities, and NBA accreditation. NBA accreditation is something that adds that ensures that a program is has a quality. Then in 2020, we got pharmaceutical management as a specialization, and since 2020, our batch size became 120 students per year from 60. In 2022, we established Center for Advancing in Digital Health, considering that there is a growing demand for digital health. In 23, we added one more program, and that is fellow program, the doctoral level program in hospital and healthcare. And the intake is 10 scholars per year. In 24, we introduced a new PGDM program, that is PGDM in artificial intelligence and data science in healthcare, and the intake is 30 students per year. And in 2025, we have got, we have been awarded with A grade by the NAC. So that ensures that, that IIHMR has a quality. In IIHMR Bangalore, we have 4 divisions, 4 verticals. One is academics. In academics, we have 3 programs, and all these programs have AICTE approval. PGDM, Hospital and Health Management, PGDM, AI and Data Science in Healthcare, and Fellow Program in Management. Then we have research and consultancy. So our faculties and research officers, they are involved in research on topics related to health systems, policy, health programs, population research, and hospital management. And we also provide consulting services to hospitals and pharma companies. We also have a training department wherein we offer MDP programs, FDP programs, executive development programs, and we also offer a range of certificate programs. And also we conduct professional practice series. And we also have one ADMIRE, that is Center for Advancing Digital Health, where we have Skilling Hub, Research and Development Hub, Digi Health Data and AI Lab, and Incubation Hub. Awards and rankings. So in 2024 and 25, we have got 10th ranking in Bangalore in Bangalore among business schools by the Outlook, and 12th ranking by the Week. We also have got AAA+ by Career 360, and you can see other awards and recognitions that we have. So since we don't have much time, so I'm skipping this slide and just moving to the next one. In terms of accreditation, I said we have been awarded A grade by National Assessment and Accreditation Council (NAC), and our program is AICTE approved. We also have got MBA equivalency by the Association of Indian Universities. That means our PGDM program that we offer in hospital and health management, that is equivalent to MBA. Our program is also MBA accredited, that is by the National Board of Accreditation. We already have discussed about pharma sector, right? So I'm skipping this one, and just I'll discuss about why anyone should join our flagship program in PGDM in hospital and health management. We have a very specialized curriculum, and it's mainly because we have a legacy of 4 decades in healthcare management, education, and research. We provide hands-on experience. As I said, in pharma management, we have a program, Pharma Consulting Practicum. We have a module on data analysis related to pharma. So we try our best to provide hands-on experience to our students. And we have expert faculty. We have many faculties at IIHMR Bangalore who have industrial exposure, and now they have become, academician here. And innovative teaching methods, 100% placement assistance, industry collaboration, and strong alumni base. You go to any hospital, any healthcare organization in India, and you'll see that there are, a couple of, IIHMR alumni who are holding the leading position. About the program highlights in this flagship program, in the first year, the intake I already have mentioned, that is 120. So in the first year, the curriculum is going to remain for everyone, right? Like in the first year, they'll get to learn about the medical terminology, introduction to pharma business environment, data analytics and visualization, and other core courses related to healthcare, and also core courses related to management, like marketing management, human resource management, essentials of health economics. And at the end of first year, they'll go for 3 months summer training to get industrial exposure. And from second year, they'll have an option to get specialization in one of the specialization areas that we have. So we have 4 specializations at IIHMR Bangalore. One is hospital management, one is pharma management, health IT management, and public health management. So if any student they choose, pharma management, they'll get to learn about pharmacoeconomics. They learn about artificial intelligence and digital transformation in healthcare. They learn about production and supply chain management, principles of clinical research and drug discovery, pharma marketing and brand management, where we cover internet, traditional marketing, digital marketing, marketing channels and sales management, and also consumer behavior. And they'll also get to learn about pharma international business, pharma legal and regulatory environment, market research, data analytics, and data management in pharma sector, pharma consulting practicum. So in second year, they'll get to learn subjects which are related to their specialization. If they choose, hospital management, they can go for material and equipment, management, marketing, management of hospital services. So they'll get the modules as per their specialization. About the eligibility criteria, we are open to any graduate. Even if they don't have any healthcare background or pharma background, they can apply, because in 2 years we make sure that they get exposure about healthcare sector and pharma sector. And minimum marks should be 50% marks, but there is some exemption for those who come from SC, ST, PWD and defense background. And also those who are in their final year, even they can apply. But before the start of the class, they have to submit their documents for verification. And also they need to appear in a management aptitude test, management aptitude test, like CAT, MAT, CMAT, that ATMA, GMAT, and KMAT. Here I provide a snapshot about the batch, about batch 2024-2026. So out of 120, maximum people we are getting from Karnataka, followed by Tamil Nadu, Andhra Pradesh, Maharashtra, West Bengal. But overall, we are getting from 70 different states. So IIHMR Bangalore is like a mini India. And in terms of graduation, we get around 26, 27 of students with pharmacy background. Then BDS we are getting every year around 2023, and then BMS, BHM, BHMS, nursing, right, and other BSc, in life science. So now more than 90% we get those who have healthcare background. Either they have done pharmacy, they have done BDS, MBBS, or BMS, or nursing. These are few of our students, who had pharmacy background, and now they are working with organizations like, Narayana Health, 𝐏𝐡𝐚𝐫𝐽 Biosolutions, Bal Pharma, HX Central, Medicover Hospitals, Tech Mahindra, and Napier Healthcare. Admission process, if anyone has interest, then they can see if they're eligible, then they can apply. They can apply online as well as offline. And once they'll apply, we'll go through their applications, and based on that, we'll invite them for a group discussion and personal interview. And based on their performance, we'll offer a provisional admission, right? And then they'll have to confirm their seat by paying some admission fee. And but their admission will be finalized only once their documents are verified. So this is the admission process at IIHMR Bangalore. These are our regular recruiters, we have ZS, we also have international placement like Burjil Hospitals comes every year. It's a Abu Dhabi based hospital. We have Fortis, Practo, Deloitte, Accenture. Deloitte is coming every year, and they hire 4 or 5 students every year. So these are regular recruiters. We have more than 90 regular recruiters, and we have many international and national collaborations, like you can see HX Central, HISP India, Maastricht University, right? And these are some empanelment and partnerships we have. We work with UNICEF, NHSRC, uh, National Health Authority, HCL Foundation, and these are the faculties at at IIHMR Bangalore, and intellectual capacity capital at IIHMR Bangalore. So Dr. S.D. Gupta, he's the president at IIHMR Society. Then we have Dr. S. Sadgopan. We have Dr. C.S. Kedar, who is a retired IS, and he's our senior advisor, and our director, Dr. Usha Manjunath ma'am. Then professors, associate professors, and assistant professors. So this is a brief about IIHMR Bangalore.
Thank you, sir. Thank you for taking our participant inside IHMR and getting them understand the different aspects that we cover, what is our capabilities, and what accreditations and statutory approvals we have. So before I just conclude the webinar, I would request my audience, if you have any questions to any of my panel expert, you can ask them whatever the interest you got it, and if you have any insights that you want to take a little more from them. We'll close in next 5 minutes. First 3 questions will be answered. Anything?
So, sir, we have got one question actually.
Yes.
Yeah.
I would like all 2 of you to answer on this with different aspects what we are doing. So what challenges that do you see from industry for recruiting new challenges? So I think Seema and Alicia both can give some insight, and even the academicians can see and give the insight how the challenges that academics are also looking at the recruitment part. Yeah, please go ahead, madam. Seema, madam, first you can start from here.
Yeah, I see that there is again, as I said, no, there is a lack of connect between the academy and industry. Your people are actually coming with the book knowledge, so much of book and so much of web in this knowledge, which is actually available. But then of course, once you are in, only you would understand how to connect, right, in the industry. But then there is so much of there is a gap. So to address that, we also mentor a lot of people, a lot of students who are, like as rightly said, for each of these in the academy, we pick up students, mentor them for about 6 months to 8 months, and then prepare them for the industry standard and prepare their mindset, and then we recruit. And there is also another challenge that we face is the stability. That is a huge the students or the whoever is joining now come with the mindset that the high package they look for, and immediately within 6 to 7 months we see there is the boredom in this work. You're like the feel of monotonous whether of this profile. Any profile that you offer, already they get bored quickly. Within you look for more of the varieties in the job, and that's not how you actually go. That's not how you grow. You have to actually give some time in industry. You have to actually understand what's going on and understand, give your time, yourself also some time to know, accept the realities. Every job has 70% of the things that you like, and there could be 30% of the things that you don't like. So either you upgrade yourself to get adapted and learn those things, or else it's very difficult. It's going to be very difficult. You just can't say that everything that job you take is 100% is what I like. So we find challenges in identifying such talents now, who are actually more stable, more dedicated. That's a very big challenge, I feel.
Yeah, thank you, madam. Thank you. Alicia, over to you.
I feel when you apply for any job in the industry, we go with the mindset that I am the best for this role. But you should also understand that there are a lot of people applying for it. And when looking from a recruiter point of view, they would choose the best in terms you might have 60% of knowledge and you might have 100% of education on the paper. But what is important is being able to apply that uh, studies and to actual real life scenarios. If you go for an interview, are you being able to apply what you studied in the interview is what really matters. And also I believe that you need to upgrade yourself uh, every now and then. You need to be abreast with what is happening. You must be abreast with what trends are in the pharma market or any market if you're applying for that matter. And yeah, that those two skills I believe. And in addition to that, you need to have a good soft skill, good communication skill, and also behavior is another factor which people don't highlight, but even that is another factor which the recruiters do look upon other than your technical skill. So yeah, work on your technical as well as your soft skill to uh, get better, options out there.
Thank you. Thank you. Vikas sir, how do you look at this question as an academician and give us an insight?
Yeah, just summarize in just one line all the fellow panelists have said. That the candidates is very important to do their SWOT analysis, what their passion is, what they want to do, and why they want to do. They have to ask themselves, and accordingly, they have to train themselves from the day one. They have to prepare their self timetables and deadlines that today I'm at this date I'm here, and after 2 months, 3 months, where I'm going to be. What I've done, just you have to prepare yourself. At the end point of time, just in telling example that I've seen in my academic voyage that most of the graduate, like for example, if we take example of the Bachelor of Pharmacy, most of the candidates just don't know why they entered into pharmacy. They entered into some influence or something like that. And up to completion of the 7th semester, they even don't know what they exactly want to do. And just in hurriedly just decide that people are doing this, so this is very mesmerizing, I should do this. Somebody suggests that this is a very good field and I should do this. This is not the way actually. Every person should, every candidate who is looking for the exploration and the career should ask him or herself that what you want to do and why you want to do. You will get an inner voice. The best teacher in this world is to be ourselves only. So if you want to enter into a particular field, you just do a SWOT analysis and then enter into it and you prepare yourself from day one. And nobody can beat you. How many competitors you have, whatever you can be able to do that. So there is nothing a point like that. The industry will be facing the challenges. Madam said that there are a lot of things. After 6 months, they used to feel bored. Why they used to be? Because they have not projected themselves. They have not prepared themselves, and they have not. Uh, it's not their passion because of some things they enter into that. So better not to enter. And if you enter, prepare with the mindset that yes, I am built for that. That's only the part.
Thank you. Thank you, sir.
Thank you.
You mentioned about SWOT. I understood that nowadays people do SWOT of the JD, not themselves. So better if they do SWOT analysis of them, so they would better understand which JD would fit for them and they can stay longer. So whenever they, student, I think even Ansari sir can give some insight on that. The student come and say, sir, which JD is good for me? And what would be the package? So basically when Seema madam also mentioned They come with the offer letter and a next 6 months rollout plan. Okay, which JD or which company, which place or whom to connect for further growth. So basically, they won't even understand what road they are going in or the further career path. Also, they could not be able to see properly on it. So it's better you sort the yourself or your skills or your strength rather than doing SWOT for the company as well as the JD of company. Sir,
Yeah,
answer is sir, what?
recently I came across one candidate who was like this only. I thought this interests me, so I spent 6 months. Then I realized this doesn't interest me. I want to change, and so that's how the mindset is now. So, and then they very, very dynamically would like to move. And
Yes.
I wouldn't blame that. That's the fault there. The fault is in system where we have so many roles which is actually emerging, and students also lack clarity. They see around, they feel that fantasize, this role may be fantasy, that role may be fantasy.
Yes.
But
Yes.
the moment you take up the role, the hard reality of every role is you need to give some time. You need to really learn that there is something that you don't like, something you like. Every job has its own plus and minus, pros and cons. So it is not a plate which is coming with a full of nice dishes and you just have to pick it up and eat. It's not that easy.
Yes, true,
Yeah,
true.
this is why I say, every student, they should do a proper research, right? I also have seen many of my classmates, they end up taking a job role, and after 1 year, 2 years, they were like, I want to join another, sector. So a proper research is very important. I see students, they don't do research even for a day or 2 days, and they are not aware about how to conduct research. I tell them that please spend 15 days and make a report on that where you want to join, because once you start doing a job somewhere, it becomes very difficult to switch. So proper research is very important before making any decision. But this question from this Santosh Patnaik, what challenges do you see from industry for recruiting new talents? I think panelists, they already have answered this. I would just reiterate what they have said. So the challenge is mainly, many companies, they are not very confident that if I hire someone, if that person is going to be very productive, because there is a gap, as we understand that there's a gap between industry, what industry needs and what academia is providing them, right? So my point is, we as academicians, we should try our best to fill that gap, and to fill that gap, we need support from industry. So industry people should also be ready to extend their support, and if we work together, yeah, we would be in a position to fill that gap. And in a very less time, our students, they'll be in a position to be productive, right? And companies will not have to spend much time on their training and on their training and learning part.
Yes. Adding to user, one is that as a teachers or lecturers, skill them up with what the industry needs is trying to fill that gap and support getting from industry is second point. And third and primary most is the students has to be interesting to learn different challenges that we are getting it from the industry. If that is what we spoke, if they don't have any interest, you be as a faculty putting more insights or industry giving more thoughts on it doesn't work out because it goes in a way and finally end up in fantasy jobs that they are looking and finally end up doing nothing or learning nothing from past 2 years or post 2 years of their masters and any of the graduation. So interest from the candidates also are most important, as it is actually it's a gap currently what academia is facing. So based on the trends and other things, even the talent is also getting more widen up and confused. So we'll have to make them narrow down into what exactly is needed for them. With this, I would like to conclude this webinar, and I would heartily thank all my panelists who joined, irrespective of date, time, and other things. In very short notice, you accepted our invitation and given the very wonderful insights on industry needs, what is happening across. As you said, madam, it's like 6 months. It may be liking or not liking. So it's a Friday evening. We are working. So 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 that is what is the industries also look for, and we are supposed to do. And maybe it's a very great evening with a very insightful thoughts and discussion that we had. Thank you very much, and we look forward to have much more conversation in different areas to get industry know about academics and academic know about industry. So so that is the one way where we can get even participate to understand, or the people who are in confused state to get to know about what industry is asking. So thank you for joining us, and audience, thank you for being patient for so much long and listening to us. I hope it was very insightful and you got something to take away this Friday. Thank you all. See you and have a very good weekend. Thank you all.
Thank you so much, Sakin sir.
Thank you, Sachin.
And
Thank you.
thank you everyone.
Thank you.
Thank you.
Thank you.